My name's Bill Monahan. I'm one of the orthopedic surgeons here at South Florida Orthopaedics. Today I'm going to talk to you about how I do my knee replacements with the CORI Total Knee System. So it's a robotic system that I think is beneficial because it uses real-time 3D imaging to give you a custom implant just to fit your anatomy. So it's not CT based, it's real-time intraoperatively. And I think that's beneficial because things can change intraoperatively from the CT scan that you may have gotten a couple months ago. So that way I can adjust the surgery to you real time. So what I do during the surgery is I approach your knee and then I take points with a probe here. So I paint your anatomy just like this, and then I get a 3D model which is up on the screen here, and that will fit your anatomy. I use a tensioner to ensure that I'm getting your knee perfect every time, and this makes me more precise and more accurate. All right. So once I collect all the data, then I can plan your knee. And this is a fairly typical screen that I would see, and I can dial it into the millimeter. That makes it more accurate and more precise. I can do it this way every time. So I can adjust the implants to fit your anatomy and balance the ligaments in your knee, so I can get a nice even balance across. So this is how I do my knee replacements. Again, I think the CORI Total Knee System is great in my hands because it's more bone conservative, soft tissue sparing. I can give you a more consistent, predictable outcome because I can do it the same way every time. I use a burr to make these cuts. And then once I've made the cuts, I can assemble your knee and give you a nice stable knee. The other advantage of using the CORI knee system, it's the only system that's FDA approved to do on revision knees. So if I'm doing a revision knee in a similar fashion, I'll just paint it like I would with the probe, and that gives me the computer outline. I then use the same tensioner, do the same steps, and then I can program the revision into the system, and then I can do your revision knee.